In every corner of the United States, thousands wake up each day not knowing that their lives could drastically change in just a month. The silent threat of a stroke looms large, a medical emergency that can strike when least expected, leaving profound impacts on health, independence, and quality of life. Despite being a leading cause of disability and the fifth leading cause of death in the U.S., the knowledge around the early warning signs of a stroke remains alarmingly low among the general population. Recognizing these early signs is not just about medical insight. It's about giving you the power to save a life, perhaps your own. This video aims to bridge that gap, to make you aware, and to equip you with the knowledge needed to act promptly, understanding and identifying the signs a month before. A stroke can happen, could mean the difference between recovery and lasting damage. Join us as we explore the 7 early warning signs of a stroke, signs that everyone should know. Not just for their own well-being, but also for the well-being of their loved ones. Your awareness and action can turn the tide against one of the most significant health challenges in the USA today. A stroke occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. In the United States, someone has a stroke every 40 seconds, emphasizing its prevalence and substantial impact on public health. Strokes are a leading cause of long-term disability and the 5th leading cause of death. There are 3 main types: ischemic, caused by blockages or clots, hemorrhagic, resulting from blood vessels rupturing in the brain, and transient ischemic attacks, TIAs, or mini-strokes, which are temporary blockages often serving as warning signs for future strokes. Understanding these types can help in recognizing risks and symptoms early on. Stroke symptoms number 1, sudden confusion or trouble speaking. Sudden confusion or difficulty speaking can be a critical warning sign of a stroke. When this occurs, individuals may find it challenging to articulate their thoughts or comprehend what is being said to them. Words might not come out right, sentences can get jumbled, and the person might be unable to grasp simple statements or commands. This happens because a stroke can disrupt the brain areas that manage language and understanding, effectively impacting the ability to communicate effectively. In the human brain, specific regions are dedicated to processing language, speaking, and comprehension. A stroke, which is essentially a disruption in blood flow to the brain, can impair these regions. Without proper blood flow, these parts of the brain don't receive the oxygen and nutrients they need, leading to sudden communication challenges. It's crucial to recognize this symptom as a potential indicator of a stroke. Immediate action is vital. If someone suddenly has trouble speaking or understanding speech, it's essential to seek medical attention right away. Early intervention can greatly influence the recovery process and outcome, underscoring the urgency of recognizing and responding to such symptoms without delay. Stroke symptoms number 2, trouble seeing in one or both eyes. Trouble seeing in one or both eyes can be a startling symptom indicating a potential stroke. This visual disturbance can manifest suddenly, affecting your ability to see clearly. People experiencing this symptom might notice blurred vision, partial vision loss, or even complete blindness in one or both eyes. The issue arises because a stroke can interrupt the blood supply to parts of the brain responsible for processing visual information. Unlike other causes of vision loss that might develop gradually, the onset related to a stroke is typically abrupt. It might feel as if a curtain has been drawn across your field of vision, or as if one side of the world has suddenly gone dark. This is because the areas in the brain that control vision, located in the back, the occipital lobes, are not getting enough blood flow and oxygen. Recognizing and acting on this symptom promptly is crucial. Vision changes due to a stroke might not always be permanent if treated quickly. Immediate medical intervention can sometimes restore blood flow and minimize lasting damage to the brain and associated loss of vision. Therefore, sudden changes in vision should always be treated as a medical emergency, emphasizing the need for swift action to ensure the best possible outcome. Stroke symptoms number 3, sudden severe headache with no known cause. A sudden severe headache with no apparent cause can be a critical warning sign of a stroke, particularly if it appears out of nowhere and is unlike any headache you've experienced before. This type of headache is often described as being the worst headache of one's life and can be a symptom of a hemorrhagic stroke, where bleeding occurs inside or around the brain tissue. Unlike tension or migraine headaches that have identifiable triggers and gradually build up, a stroke-related headache is abrupt and severe without any clear reason. The mechanism behind this is straightforward yet serious. When a blood vessel within the brain ruptures or is blocked, it can cause a rapid increase in pressure within the skull. This sudden pressure change is what triggers the intense headache. Since the brain itself doesn't feel pain, the pain is actually coming from the pressure, and irritation affecting the surrounding tissues and blood vessels in the head. It's important to treat this symptom as a potential emergency. The presence of a severe, unexplained headache, especially if accompanied by other stroke symptoms like weakness, dizziness, or changes in vision or speech, requires immediate medical attention. Early diagnosis and treatment can significantly reduce the risk of long-term damage or life-threatening complications. Therefore, recognizing and acting upon the occurrence of such a headache can be life-saving. Stroke symptoms number 4, sudden dizziness, trouble walking, or loss of balance. Sudden dizziness, trouble walking, or a loss of balance can signal a stroke, acting as critical indicators that something is disrupting the brain's control over the body's coordination and movement. This disorientation and difficulty in maintaining physical stability can happen without warning, making simple tasks like standing up or walking straight suddenly seem challenging or even impossible. The cause of these symptoms is the interruption of blood flow to parts of the brain that are crucial for balance and coordination, such as the cerebellum or the brainstem. These areas are responsible for processing signals from the inner ear, which helps with balance, and coordinating muscle movements. When a stroke affects these regions, it can lead to a sudden and profound loss of motor control, resulting in symptoms like dizziness, a feeling of spinning, loss of balance, and difficulty in walking. Experiencing these symptoms, especially in conjunction with others like weakness on one side of the body, confusion, or visual problems, should prompt an immediate medical response. Quick action is essential because treatment options for stroke are most effective when administered early. Recognizing these signs and seeking help can not only save lives but also significantly improve the chance of recovery and reduce the risk of permanent disabilities. Stroke symptoms number 5, weakness or numbness in an arm, leg, or face, especially on one side. Weakness or numbness in an arm, leg, or face, particularly on one side of the body, is a hallmark sign of a stroke. This symptom often appears suddenly and can range from a subtle feeling of weakness to complete paralysis of one side of the body. The sensation might feel like part of your body has fallen asleep, but without a clear reason, like sitting or lying in an awkward position. This occurs because a stroke disrupts the flow of blood to areas of the brain responsible for controlling muscle movements and sensation. When one side of the brain is affected, it typically results in weakness or numbness on the opposite side of the body, given the brain's cross-wired connections to our physical functions. Understanding the brain's anatomy helps explain this phenomenon. The brain is divided into 2 hemispheres, each controlling the opposite side of the body. So, a stroke affecting the brain's right side will impact movement and sensation on the body's left side, and vice versa. The reason for the suddenness of these symptoms is the abrupt interruption in blood supply during a stroke, which prevents the brain cells from functioning correctly. Immediate recognition and response to these symptoms are critical. Even if the weakness or numbness seems temporary or fluctuating, it should be treated as an emergency. Time is a crucial factor in stroke treatment. The sooner medical intervention is received, the better the chances of minimizing long-term damage and maximizing recovery outcomes. Stroke symptoms number 6, unexplained fatigue. Unexplained fatigue, a profound and sudden feeling of exhaustion that cannot be attributed to lack of sleep, overexertion, or other identifiable reasons, may also signal a stroke. This type of fatigue is distinct from the normal tiredness people experience after physical or mental activity. Instead, it's an overwhelming sense of weariness that doesn't improve with rest and may come on abruptly. In the context of a stroke, this fatigue occurs because the brain is struggling to perform its normal functions due to the interruption of blood flow. The brain requires a constant supply of oxygen and nutrients to work efficiently. When a stroke disrupts this supply, even the simplest tasks can become daunting, leading to an unexpected and severe drop in energy levels. The areas of the brain responsible for cognition, motor control, and even emotional regulation can be affected, making it hard for individuals to carry out their daily activities. This fatigue can be a puzzling symptom because it is less specific than other stroke indicators, like facial drooping or speech difficulties. However, when it occurs suddenly or is accompanied by other symptoms of a stroke, it should not be ignored. Recognizing this sign and seeking prompt medical evaluation is crucial, as early intervention can significantly impact the recovery process and outcome. If you or someone you know experiences unexplained sudden fatigue along with any other stroke symptoms, it's essential to consult a healthcare professional immediately. Stroke symptoms number 7, brief episodes of numbness or weakness, transient ischemic attacks. Transient ischemic attacks, TIAs, often referred to as mini-strokes, manifest as brief episodes of numbness, weakness, or other stroke-like symptoms, typically lasting a few minutes to a couple of hours before disappearing completely. These episodes are caused by a temporary disruption in the blood supply to part of the brain, spinal cord, or retina, which does not cause permanent damage but serves as a critical warning sign of a potential future stroke. TIAs share similar causes with strokes, such as blood clots or narrowed blood vessels, and they can affect the body in ways that closely mimic a full-blown stroke. Symptoms may include sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, problems with balance and coordination, and sudden severe headaches with no known cause. Because the symptoms of a TIA are temporary and can disappear completely, people often overlook them or mistake them for minor health issues. However, experiencing a TIA is a major red flag that indicates a high risk of a future stroke. Immediate medical attention following a TIA can help prevent a stroke by allowing healthcare providers to evaluate the cause of the episode and implement preventive measures, such as medication to thin the blood or surgery to remove blockages in blood vessels. Recognizing and acting on the symptoms of a TIA promptly can be life-saving and significantly reduce the risk of enduring a stroke with permanent effects. If you or someone near you starts to show signs of a stroke, such as sudden numbness, confusion, trouble speaking, or a severe headache, it's imperative to act swiftly. Immediately call emergency services. Do not wait to see if the symptoms dissipate on their own. Time is of the essence when dealing with a stroke. The sooner medical treatment is initiated, the higher the likelihood of preventing permanent brain damage and improving recovery chances. Hospitals are equipped to handle such emergencies with treatments that can minimize or even reverse the effects of a stroke. But these treatments are most effective when administered as soon as possible after symptoms begin. Reducing the risk of a stroke involves adopting a healthier lifestyle and making informed health choices. Prioritize a balanced diet rich in fruits, vegetables, and whole grains while limiting saturated fats, cholesterol, and sodium to manage blood pressure and cholesterol levels. Regular physical activity, aiming for at least 150 minutes of moderate exercise per week, can help maintain a healthy weight and lower blood pressure. Avoid smoking and limit alcohol consumption, as these can significantly increase stroke risk. Regular health checkups are essential for monitoring blood pressure, cholesterol, and diabetes management. Managing stress through relaxation techniques and ensuring adequate sleep also play a crucial role in stroke prevention. We urge you to share this video with friends and family to spread awareness about the early warning signs of a stroke and the importance of acting quickly. Knowledge is a powerful tool in the fight against stroke. Take the time to discuss your individual stroke risk factors with your doctor and explore ways to minimize them. Stay informed about health issues by regularly seeking out reputable sources of medical information. By taking these steps, you not only empower yourself but also contribute to the well-being of your community. Together, we can make a difference in preventing strokes and saving lives.